Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Friday, April 2nd, 2021. Well, we are definitely moving into a fourth wave here. As worldwide, we saw an additional 4.1 million new cases. That's up about 200,000 from last week. Here in the United States, we saw 460,000, which is about 60,000 more than we saw the week before. And here in Massachusetts, we saw about 16,000 new cases, about 2,000 more than before, crossing some more milestones there, with the United States reaching 30 million total cases, and the world likely to cross 130 million later today. When we look at deaths, these are a little more varied here, 46,000 new deaths worldwide, 6,000 in the United States, which is roughly the same, maybe slightly less than last week, as here the trends have not yet started to turn up quite as much. And here in Massachusetts, we lost 207 people to COVID-19, which is almost exactly what we lost last week. Things more or less the same there. When we look at cases, though, we can definitely see things are trending upwards again. We are more or less at the point right now we were at the summer peak, and we did turn that one around, fortunately, but that was in the middle of summer, easier time to turn things around, and this looks more in line with where things stood in October, going back upwards again. So hopefully that won't go to the heights we saw before, and it shouldn't with the vaccines we have out there, but still a disturbing upward trend. Part of the issue, though, is when we look at testing, it's actually really far down across the country. Here in the Northeast, we're doing the most testing per capita. But when you look at this way, I saw somewhere that the amount of testing they're doing per capita, not raw testing, but per 100,000 people, is something like 20 times higher in New York than in Kansas, which is doing some of the least. So it's very possible that while we look at the case numbers and we see a lot more up here in the Northeast, part of that may just because we're not getting accurate numbers from a lot of the country anymore because the testing has dropped off so far. And that's really unfortunate and disturbing. So yeah, there may be a lot more going on right now that's been kind of left by the wayside, either by just general lack of interest and resources or by switching over to vaccination campaigns in favor over testing, which means that things could be a lot more worse than we think they are at the moment. Look at hospitalizations. These are starting to tick back up, which is perhaps the surest indicator that we are moving into a new phase of the pandemic. Things have plateaued and are starting to tick back up. Hospitalizations are much less, as a tracking metric, are much less prone to being thrown off by data irregularities, by days of the week, by holidays, by weather events. So they're generally a pretty reliable metric of where we're at. And you can see, we stopped declining in mid-March and now are slightly going up, but that's a trend that once it starts, takes a while to come back down again. When we look at new admissions, it's a little bit more clear. This is the number of new people coming into a hospital on any given day. And here, there's a much clearer uptick in that, both just in the last couple of days and when we look week over week. When we look at deaths, though, this has not started to trend back up yet. This will be the last one to tick up and may not really increase as much as the others, just because the most vulnerable people are vaccinated right now. But we wouldn't be surprised to see this start to head upwards in a couple weeks. One positive thing, though, is when we look at long-term care facilities. These are data from nursing homes. The top is the cases, and the bottom is deaths over time. And as you can see, these have really dropped off. And a lot of this is because people have been vaccinated so much in those settings. So hopefully the most vulnerable people will be much more protected in this next wave, becomes a real wave, than in previous ones. So that is at least one positive aspect going forward. All right, let's look at some new developments in the pandemic right now. First up, the FDA authorized Moderna to increase the number of doses that go in a vaccine vial to 15, up from 10. This may not seem like a big deal, but this actually will greatly increase the amount they can put out there, because one of the bottlenecks in vaccine production is the actual vial filling and that process. And if you get 15 doses instead of 10 into a single vial, that part goes a lot faster. And then also it makes distribution easier because you can send out more vaccine in the same amount of space. So that's a great step forward for getting more doses out around the country. Also, Pfizer released some early data on its testing for 12 to 15-year-olds for the vaccine, which was so far in the early preliminary data 100% effective. Now, this was just an early, smaller report. We'll get more data later on, but it showed very promising results. Obviously, we don't expect it to stay 100% effective, but by and large, that is promising for its final results, showing that teenagers actually produced stronger antibody levels than adults in response to the vaccine. So that is a good step towards getting vaccine available for children, for teenagers, to vaccinate that one step of the population which is currently ineligible, and make sure that everyone can be vaccinated to really put an end to this thing. Also, new estimates are saying that variants are currently making up about a third of all US cases, which is very worrying, because these are generally more transmissible and maybe partly responsible for what we're seeing now as the increase in case count. So that's something we have to watch out for. By and large, the vaccines are still very effective against the variants. But that doesn't mean that we need to give them these variants, any more leeway. The more vaccine we get out, the more people continue to practice all those public health measures, wearing masks, practicing distancing, to prevent those variants from taking hold even more. And finally, there was some unfortunate news for Johnson & Johnson, where their plant in Baltimore, which makes a lot of their vaccine production, setback, where due to human error, there was a mix-up in their vaccine production. The plant produces both the Johnson & Johnson and AstraZeneca vaccines, and basically mixed up the recipes a bit. So about 15 million doses worth of vaccine product had to be discarded because they were cross-contaminated, basically the equivalent of trying to make two different recipes and switching an ingredient in each one. So neither one can go out. Now, none of this actually contaminated any existing doses. There was no doses sent out that are going to be ineffective or dangerous or anything like that. It's just a lot of waste, unfortunately. Now, they still expect to meet their production quotas for April. But again, it's disappointing because with the single shot dose, that's a lot of people that could have been vaccinated in one go. But fortunately, Pfizer and Moderna are expected to have plenty of doses going that we can still make full eligibility for every adult by May. And you can find our sources in the New York Times, mass.gov, and the CDC. And for more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.